Hello everyone, welcome to Diagnose It. So now let's discuss our new case. So a 9-month-old baby is presented with decreased muscle tone, increased reflexes, seizures, visual disturbances, and a typical feature is given, that is the cherry red spot is present in the macula of the eye. As we can see in the image, there is presence of this cherry red spot in the macular region of the eye. So this is obtained by fundoscopic examination. So now let's discuss what is this case. So it is a case of Tay-Sachs disease. Based on the findings, we can say that it is a case of Tay-Sachs disease. Tay-Sachs disease is a quite rare disorder and it is autosomal recessive. So autosomal recessive means there is equal onset in both the males and females. There is equal onset in males as well as females. In this disorder, the patient usually exhibits a severe clinical course and the death also occurs in quite early childhood, that is up to the age of 2 to 3 years. It is very serious disorder, but also it is quite rare. So what happens in Tay-Sachs disease? There occurs a deficiency of an enzyme which is known as the hexosaminidase A. Hexosaminidase A. So this disorders mainly occur due to the deficiency of this enzyme. So what is the function of this enzyme? So this enzyme is responsible for the breakdown of a glycolipid which is known as the GM2 ganglioside. GM2 ganglioside. Tay-Sachs disease is a progressive, lethal, and neurodegenerative disorder. The early diagnosis of this disorder is quite clinically challenging because of the subtle clinical features which is present, and also the development of symptoms also takes some time. So this was the introduction of Tay-Sachs disease. So now let's discuss about what happens in Tay-Sachs disease. So in Tay-Sachs disease, there occurs the mutation in the gene HEXA, which is located on the long arm of 15 chromosome, that is the 15q23. Due to this mutation, there can be either complete absence of the enzyme, which is the beta hexosaminidase, which is coded by this gene HEXA, or there can be abnormal formation of this enzyme. So now what this enzyme is responsible for? It is responsible for the breakdown of GM2 ganglioside. So due to this, there will be no breakdown of GM2 ganglioside and hence the accumulation of GM2 gangliosides take place. The ganglioside accumulation is seen in all the tissues, but it is predominant in the central and autonomic nervous system as well as in retina. Now talking about the neurons, what happens is that the accumulation of gangliosides occur to a toxic level which leads to the neurodegeneration. And also on the histological examination, due to accumulation of these gangliosides, the neurons appear balloon shaped with a lots of cytoplasmic vacuoles, as it is seen in the image also. We can see these balloon shaped neurons. And what these cytoplasmic vacuoles consist of? They consist of the distended lysosomes with the ganglioside. So as we know that the Tay-Sachs disease is a lysosomal storage disorder. Now talking about the how this cherry red spot in macula of eye develops. So as the GM2 ganglioside accumulates in the retinal ganglion cells, which are high in density around the fovea. So due to this, the swelling of these cells, ganglion cells, occur, and hence they appear as gray-white colored. The center of the fovea has no ganglion cell, therefore there is no swelling and no gray-white appearance, and hence it retains its reddish appearance, due to which there appears a characteristic cherry red spot in the macula of the eye. It is a near specific finding in Tay-Sachs disease and can be confirmatory for the diagnosis of this disease. Now talking about the onset of the symptoms in Tay-Sachs disease, so we can divide it into infantile type, juvenile type, chronic type, and also there can be the late onset of the symptoms. So in the infantile type, the onset of symptoms occur in the 3 to 6 months. In the juvenile type, the symptoms take time for around 2 to 5 years. In the chronic type, it occurs in the first to second decade of the life. And in the late onset, it occurs in the second to third decade of life. So now the common symptoms which we can see in these infantile, juvenile, and chronic type are: there is CNS degeneration. The CNS degenerative symptoms can be seen. There will be increased muscle tone, decreased muscle tone. There can be increased reflexes, and the seizures and visual disturbances can be seen. Visual disturbances can be seen. And in the late onset, it is characterized by motor difficulties, and also there is bipolar type of psychological symptoms. So this was all about the onset of symptoms in Tay-Sachs disease. Now let's talk about the diagnosis part. So the classical clinical findings of progressive weakness along with the developmental delay and the characteristic presence of the cherry red spot on the finding which is made using the fundoscopic examination and also the generalized hypotonia with sustained clonus can help in making a diagnosis for the gangliosidosis or we can say the Tay-Sachs disease. Also, along with these, the serum level examination of the hexosaminidase enzyme and total hexosaminidase can be quite helpful. The MR spectroscopy is also a viable parameter and it will be good tool to detect and quantify the neuronal damage, and also it can also be used to check for the response which the person is showing to the treatment. Also, we can offer the molecular genetic testing as it is a genetic disorder also. So this was all about the diagnosis part. Now let's discuss about the treatment. Now, as such, the Tay-Sachs disease does not have any proper cure, and the treatment we can offer is largely supportive. The supportive treatment is there in this disorder. And what is the aim of this supportive treatment? The aim will be to provide adequate nutrition, to control the seizures by giving the patient with antiepileptics, and also the managing the infectious diseases, because the random rapidly occurrence of these infections are one of the major cause of the death of the individual. Managing the infectious diseases. The enzyme replacement therapy can also be given, but currently it is quite less effective because the enzymes which are given, they are unable to cross the blood-brain barrier, and hence the treatment is not that much effective. So this was all about the Tay-Sachs disease. Thanks for watching, and don't forget to like, subscribe, and share Diagnose It, and also do follow us on Instagram also. Thank you.